Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. So, Janet, tell me what's going on, with your stress level. What diagnosis would you be diagnosed with?
I was diagnosed with PTSD, and I was under tremendous stress.
So, how long do you that diagnosis been?
Oh, that was like 20 years ago.
20 years ago. So, for 20 years, you've been diagnosed with PTSD. Did you have any treatment for that?
Yes, I was under I went to a psychologist for a year.
Psychologist for how many years?
1 year.
1 year. Okay, so you see psychologists. What else?
And then I had just a regular doctor. I've tried different treatments, but nothing seemed to.
So did they give you medication like antidepressant and stuff like that?
Oh, yes.
Okay.
Actually, he tried 12 different medications.
For stress, for depression?
Mm-hmm.
Okay.
Right, and it just made it worse.
Okay. So did you have like side effect like suicidal thoughts and stuff like that? I'm so sorry. Okay. So are you on any medication for depression now?
No,
okay.
No, I just I'm not going to do that.
So the medical diagnosis with PTSD and depression.
Right.
Okay, so we're gonna do the BPT treatment, but before we do that, I'm gonna take your blood pressure, and then we'll take it afterwards. Okay. And how much is stress from 0 to 10 when you think about that? 10 is like really very stressful.
Probably 9.
9. Okay. So 9 out of 10, and your blood pressure now is 142 over 70, and your heart rate 58. Okay. We're gonna retest it again after the treatment. So we're gonna put this over your forehead here, okay, all the time. So you're not gonna get up, okay?
Right.
So we're gonna start the BPT session now, and I have the patient wrote the list of the traumatic event and the fear that actually triggered the PTSD. So and I will have it in here. So that's for her reference in case of she need to revisit that, and I will guide her through the session. Okay, so we're gonna start with the prep. So before the session, we have a prep, like some positive word, and the patient gonna start with those words. So let's start with peace. And just thumb up when you finish it. Okay, I want you to imagine you are in a gray room, nothing in this room except you and black boxes, black paper boxes. Each of those boxes presents one of the trauma you had, or fears, or anxiety you have. So those paper boxes, you have a fire in the front of you. So you're gonna take with your hand each box and throw it in the fire. You can take one box at a time, or you can take a combination of boxes. And I want you to do that for all the boxes. And if you don't remember there's an event order you had or not, you can reference the paper that you wrote. And just burn them. Watch those boxes until it's totally burned. And just let me know when you're done. Make sure you watch the box until it's totally burned so you can move to the next box. And if there is any boxes in your body, you need to take them and burn them. Okay, we're gonna do the closing for the session now. Let's start with a piece. Just relax. Take deep 20 breath while I'm taking off the Magna Pro. That's what we use it for the treatment as part of the BPT. We just finished the BPT session. We used the Magna Heal Pro with the exercise, and now we're gonna take your vitals again. Okay? So I want you to think about your stress level that you had before, and just take your vitals. Okay. Okay. So it went down to 129 over 68, and your heart rate is 56. How's your stress level from 0 to 10 now when you think about the stuff you worked on today?
Maybe 3.
Okay, 3. That's very good. Okay, so we started with 9 out of 10. Okay, your blood pressure was 142 over 70. Your heart rate was 58. Okay, now after the treatment, your stress level is 3, so it went down to 3. Your blood pressure is 129, so it went 8, and your heart rate went down to 56. How do you feel?
I feel calm.
Uh-huh.
I can relax.
Okay, so if I ask you now to revisit those, like think about those events, do you feel like the tense, the stress that you used to feel, or what kind of feeling you feel now?
Almost like it doesn't matter.
It's neutral, like objective.
Right.
So before this, because I personally had PTSD, so one of the things with PTSD, you were living the event as you are still in the event. That's part of the PTSD. But when I did the BBT on myself, I started thinking differently. But I want to hear from Janet. Do you think you were living it, or you think you are outsider and just it's a movie?
Yeah, I don't. It's really funny because I don't feel like I'm still in it. I feel like
Past.
yeah.
Yeah, that's usually the normal closure for PTSD. When we have a closure, you will look at it as a history. We don't erase it with BPT, but we look at it as a history that's not taking hold of. Do you experience euphoric feeling after the treatment?
Very much. Yeah, I just want to.
Okay, so if like how much, like how you feel like euphoric wise or emotion wise now?
I just feel very rested and calm, and like I could just go sleep.
Okay, you feel happy?
Yeah.
Okay,
Very calm.
awesome.
Before, when I talk about it, or anybody would ask me, I didn't want to think about it. I didn't want to talk about it because all those feelings just came up again.
Anxiety.
All the, yeah.
Yeah, the emotion of revisiting the event now, it's just tense you up.
Right.
But what about now? If we wanna, we're not gonna talk about it on
Right.
camera. But what about now? If I ask you to tell me about it, how that gonna make you feel? Or
Yeah, I think I just feel like, well, I don't even feel like I'm talking about me. I feel like I'm talking about an event
History.
in the past. Yeah.
beautiful. So, honest opinion, you had PTSD for 20 years. You had psychotherapy for a year. You said you tried 12 different medications for depression, and we just had one session of BPT. Can you tell a difference and what you're feeling about it?
I really can tell a difference. I feel so much better. I mean, and I didn't even realize. I mean, I had horrible dreams about the past,
Mm-hmm.
but daily I tried to just block it out of my mind, and now it's like I feel like I can revisit it, and it doesn't bother me.
Yeah, that's very classic for PTSD, revisiting the event with nightmares.
And
Yeah.
that they were bad.
Yeah, and that's affecting you. Okay. Awesome. So any recommendation for other patient about BPT?
Definitely, definitely. I mean, 20 years of trying all kinds of different things. Try it because it works.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.